Now let's take a look at the health sector. We have that Nigerians all over the world are celebrating the 63rd anniversary day. Kaftan TV spoke to experts in the health sector and citizens on the streets of Abuja to ascertain the improvements of the health sector amidst challenges faced over the past years. Also examined were the requirements to further strengthen the sector. Zainab Akogun tells us more.
Since 1960, Nigeria's health sector has been unstable as a result of lack of good management, ranging from provision of health facilities, employment of experts, amongst others. The sector started with 65 government nursing and midwifery training schools, and in 1946, the Ministry of Health was established to coordinate health services throughout the country. About 70% of Nigerians are living in poverty, whilst critical and essential expenditures capable of contributing to improved public health are often not prioritized. At state level, the less privileged who are cramped in the informal economy are forced to pay tax from their lean resources but see little benefits in terms of healthcare delivery, which results to self-care medications. The inadequate budgetary allocation to healthcare has also significantly influenced recurrent and capital health expenditures. The budget allocation on health has been tremendously low from 2014 and 2020. And from 2016 till date, the healthcare budgetary allocations have always fallen below 15% of the national budget allocation. Speaking to health experts in Abuja on the improvement in health system, Aisha Buka Ali, founder of Diabetes Help and Enlightenment Organization, said health facilities are not sufficient for the population of the country, and also the lack of manpower.
When you look at the health sector, the facilities are not enough. The manpower, that is the doctors, are not sufficient. The little we have who are ready to work are not well taken care of. There's a lot of problem faced by our health sector in terms of the lack of good care to the healthcare management. Because most doctors, you could see on and on, they have a lot of problems. They do a lot of interaction with the government to ensure that they are being taken care of, their welfare to be improved. But the government is not ready to do that, and that is a serious challenge to the country, because that is prompting the doctors and the healthcare workers to live for a better and greener pasture outside the country. Most of our hospitals these days in this country are dilapidated, and they are really very bad condition that the patients and the healthcare workers are finding it a very great challenge to work in that environment and for the patients to get successful and good care, because most of the machines and facilities and equipments that you find in the hospitals are either not working or are not functional. And the doctors, even if they have the knowledge to introduce these facilities or to introduce the modern way of treatment, they cannot do it because it is not well managed. And nobody is finding it easy in this modern society to tackle health challenges without intervention of new technology.
Onuche Audu, who is a consultant and gynecologist, said some aspects of the health sector has greatly improved, but others need to be tackled, including adequate provision of facilities, provision of security, maintenance and equipment, while ensuring the welfare of doctors are considered.
Aspects have evolved, who've improved in the sense that we have some of these equipment and some of these procedures can be done in Nigeria, but the accessibility and availability or widespread across board in the country that can be questionable. And this owes to a lot of factors that I'm sure will take handle security issue, make it more conducive for people to practice, not necessarily only in the developed cities or big cities of the country like the capital, Lagos, Abuja, and the like. Then, of course, there should be some form of incentive because people are risking themselves, going far away from their families and all that to go and work in other far places that have been notorious for bandits and kidnapping and all that. So people that risk to go and work in those places, there should be some form of compensation to make it attractive for them to work in those places. And also people that would choose or will be willing to work in rural areas, there should be some form of incentive for them, because people know that, oh, they'll make more money in the cities. Of course, the city will be crowded. But if people know that, okay, you can remain in your state, remain in rural areas, local governments, state capitals and all that, and be well paid and taken care of, then naturally people can consider staying in those places to practice.
Taking a drive through the streets of Abuja, residents are still going about their activities while refraining from necessity for healthcare. Speaking to some citizens, they shared their experiences on lack of facilities and other issues the government needs to improve on. Mr. Clements shared his experience after visiting the General Hospital and the lack of facilities, and called on the federal government to help provide adequate facilities to help the citizens.
When I went there, they placed something on my teeth. They could not get the actual teeth that is really paining me with all the touch. They now asked me to go home and start taking a tablet that the whole thing will stop. But up to now, I haven't gotten any results. So I'm here to pull off the teeth finally. Yes, that they don't have equipment. They don't have equipment because what they were using was archaic. The equipment wasn't up to date. Understand? They don't have equipment. That is it. They don't. They have to come and check and know what to change and know how to upgrade the system. Understand? So they knows what to do, my dear. The government knows.
While Salman Ahmed called on federal government to employ more health workers and also provide more facilities.
Their facilities are very poor, and most of the times, because there are things that you want to do, that you can't. Even the doctors as well. Take a look at the strike that are going on. For example, now most of the hospitals, like the government hospitals, they are mostly on strikes. Why their doctors look for chance or way to go to the private hospital to get a job? The government should improve, like get better doctors in all the facilities, like private sectors, government sectors, like all of them. They should just improve in all that.
Consultant Onuche Audu added that medical practitioners require more care, as many have had to leave the country to go search for greener pastures. He called on the government to protect and make the country conducive for them in order to avoid the popular Japa syndrome.
Also, a lot of people would not like to go to rural areas because their safety is, of course, of paramount importance to everybody. There have been cases where health personnel, doctors, even coppers have been kidnapped and all that, and some have been attacked and even killed or maimed because somehow people feel that doctors are well-to-do and are very wealthy and rich, and it's not always the case. So there are soft targets for kidnappers and things like that. So also job satisfaction, because if you've spent so many years in medical school, you graduate as a doctor, several years again to become a specialist, and maybe if you decide to venture into a subspecialty, it takes you much more years again. So after doing all of this, you have the knowledge, the theory of so many things, procedures you can do for investigations, for diagnosis, for treatment, and all that, and not having these technologies to work with can be frustrating. So this fuels the fact that people tend to look for greener pastures. There is what we call the Japa syndrome, whereby doctors, of course, tend to leave the country to greener pastures. I think the government can invest more, and of course in collaboration with the private sector, in having some of all these equipment for specialized treatments, more readily available.
With the advent of the new administration, citizens hope to see more improvements in the health sector. Zainab Akogun reporting for Kaftan TV News.